Friends, all of us around this table are the converted. I think there's not one person here who is not committed to a publicly funded quality healthcare accessible to most Indians, if not all Indians. But if we preach to the converted, that does not help. So this roundtable is a very focused and purposive one. This is not about expression of our angst or description of our conditions, except to the extent that that will facilitate development of a better model and our efforts to make that happen. We have three specific objectives today. One, to make a compelling economic argument backed by evidence for something approximating a universal healthcare. Not an emotional argument, not a moral argument. Not that they're not necessary, but we have to ultimately persuade the government and decision makers. And we perceive a sense of reluctance to look at a socialized medicine or universal healthcare unless there is a compelling economic logic. So that's why I'm deliberately setting the bar high. Otherwise, a moral argument is very clear. Emotional argument is very clear, but we have to make a compelling economic argument, a case that cannot be easily resisted. Two, to come up with, there are many experts here who worked for a long time in this sector. They come up with terrific models and insights over a period of time. Now is the time to synthesize. There's nothing very original, but we have to synthesize, and together we have to come up with some model which meets at least three standards. A, it is feasible. Politically, administratively, logistically feasible. B, it is effective in delivering the outcomes that we all seek. C, it is affordable to the country. Now, saying that UK spends 8% GDP, US spends 8% from public exchequer, some other country spends 5%, all this is nice, but that doesn't take us anywhere. We have a certain situation in India, therefore, unless it is feasible, effective, and affordable, given the specific Indian context with all our strengths and weaknesses, the model will go nowhere. Ultimately, we must achieve a realistic outcome. If we're aiming at 100 today, at least 70, 80 must be achievable in the next 1 or 2 years. And the policymakers and the political executive and the parties must come on board. And unless we work on that assumption, this will be a futile exercise. Therefore, it has to be a very focused thing. A certain model has been attempted on the basis of synthesis of all the existing literature and efforts and expert committee reports. This is not written in stone. There is no one model which really works everywhere. India is a diverse country, therefore all we can look at is some generic approach based on the available numbers. Even numbers are very confusing. There are all kinds of data problems in this country. We all recognize that. So we make some assumptions, we make some guesswork, we have some ballpark numbers, hoping that they're not too far wrong, maybe 20, 30% wrong, but not wrong by an order of magnitude. But we have to come up with a model we all can broadly live with, and we'll keep on improvising the model. Even as the government starts implementing it, if they do implement it, I'm sure they'll find many more better approaches with more experts and more experienced practitioners coming to the fore. And C, we have to start a process of networking informally, create some kind of a universal healthcare network, and look at strategies systematically to try and make this happen. Once we broadly agree on a certain model, we have to make this happen, and therefore that effort is equally important. Therefore, these are the three specific outcomes we are seeking. Let me recap. One is to make a compelling economic case which cannot be resisted by any reasonable organ of state or a functionary in government or political parties, and also that appeals to the country at large, and to come up with a viable, with a feasible, with an effective and affordable model, and to have some kind of an action plan about and a strategy to make this happen by pursuing the matter. Already we have a meeting scheduled on the 25th, day after tomorrow, with the Niti Aayog. They asked for a presentation on this. It's good that they asked it on 25th, so that we take the feedback of this team today and incorporate that. As I said, nothing is written in stone, but that's the first step. But that's a very small first step. There's a lot more to happen, and we really have to together pursue this. We're already very late as a country, we all know that. And at least now in the next few years, if we make this happen, this will be one of the greatest accomplishments in independent India. I'm particularly grateful to all of you. In summertime, at enormous personal privation, people have taken the time off on a Saturday to be here for a whole day, and that means a lot. And I'm sure more people, more people will join. And I'm particularly thankful to both Shiva and Praveen for that enormous time, energy, and sacrifice.
जो कोई भी किसी मजहब पर चलना चाहता है वो चले। हम एक अज़ान के लिए रुक गए तो मैं अपनी तकरीर जारी रखूंगा।